Well, they're supposed to only treat the medically underserved here in Florida, but an ABC Action News hidden camera investigation reveals the alarming truth about some Florida doctors we found offering needy patients questionable care.
I-Team investigator Katie LaGrone has the results of a 2-month investigation that just became the topic of a statewide discussion.
You're looking inside a Florida office, owned and operated by this medical doctor.
Dr. Navavi, Katie LaGrone, I've been calling, requesting the interview with you.
Who wasn't interested.
This is a concern for the Board of Medicine.
We can talk about this later.
In speaking with us.
Dr. Navavi?
Here's why.
Known as areas of critical need, it's a temporary medical license granted to doctors who don't qualify for a regular one. Right now, there are nearly 750 Florida doctors who have one, which allows them to practice only in locations like this, where doctors are few and the medically underserved is many.
Dr. Josefina Lozano is among them. State records show Dr. Lozano offers medical care at this office in South Miami. But inside, we discovered that medical care is a full-blown med spa with services ranging from laser hair removal to permanent makeup. With a hidden camera and $40, I heard her pitch on Botox. Moments later,
Are you allowed to perform non-critical type of procedures?
No.
we caught up with her.
It's non-critical. It's not critical in the sense that it's an emergency.
Right.
It's critical in the sense that you're helping people underserved.
Like the underserved who need Botox?
No, underserved who needs a medical care.
She's right. According to the state, area of critical need doctors are not limited in the kinds of procedures they offer, just as long as it's in a state-approved area of critical need. Her med spa is.
Why do you think the patient is going to have an issue?
Well, there's plenty that can go wrong.
Dr. Stephen Rosenberg serves on Florida's Board of Medicine.
It's pretty scary that all of these things are being provided and obviously are not medically necessary.
He believes Florida's area of critical need law and map are in need of a facelift.
I think the problem is twofold. One is, how do you define medically necessary care, which is what they should be providing? And then the other is, what areas really have a shortage of physicians?
Or, as we discovered, no shortage at all. This is Dr. Mariam Nabavi, approved to provide area of critical need care at the Charlotte County Jail in Punta Gorda. But we found her at this med spa in Fort Myers, 30 miles south, in a medical park. No area of critical need here. I went inside and captured images of Dr. Nabavi's Wall of Fame before coming face to face with her for my own free consultation.
Hi, Dr. Navavi, Katie LaGrone.
Which led to a follow-up
Requesting the interview with you about.
outside.
You're not supposed to be practicing in an area that's not deemed an area of critical need, and so you have a med spa
We can
and
discuss
giving
this at another
Botox and facials. I mean, is that?
If she's working in an independent location that was not approved for being an area of critical need, then that would be considered illegal.
Obviously, you know the rules for area of critical need doctors, and
We are trying to do our best to try to help people.
Even if the so-called need is anything but critical.
our investigation prompting a statewide discussion among Florida's top doctors at a recent Florida Board of Medicine meeting here in Orlando. At issue, re-examining the state's area of critical need maps and policies to determine if changes need to be made. Changes would have to come from the state legislature. I'm I-Team investigator Katie LaGrone, taking action for you.